After weeks of lockdown and the overwhelming anxiety associated with COVID-19, officials say the mental health of the average Bahamian is something that shouldn't be overlooked. The mental health care professionals of the Bahamas Psychological Association are doing their part to help. Since the pandemic began, the BPA has ramped up its telecounseling practice, where psychologists offer mental health and psychosocial support via Zoom, WhatsApp, and WebEx conferences. BPA President is Dr. Wendy Fernando.
The Helpline was actually instituted in September, shortly after it's the Mental Health and Psychosocial Support Helpline, shortly a few days after Dorian. And in March, when we had our first, or just before we had our first case diagnosed, or I think it was shortly after, we repurposed the line for COVID-19 MHPSS. Of course, it still is COVID-19 / Hurricane Dorian mental health and psychosocial support. So that's a helpline. So people would typically call in if they're in acute distress. So for us now, what we have seen is you talked about anxiety. And certainly there has been an increase, but I don't know if it's an increase or these persons may have already had a pre-existing or a propensity towards anxiety.
Now, Dr. Fernando adds that mental health care professionals have seen an uptick both locally and globally with the use of telecounseling.
What it typically is that because we're not doing face-to-face, or we were not doing face-to-face, we introduced telepsych, and it's been used for a very long time, but not so much as it is now, and because we can't do face-to-face as I stated, but it's been used for persons who may be living outside of the country or on another island. But now we're doing it for everyone, for the most part, and so that's been definitely an uptake, and that's globally as well. That's not just us, but that's globally. Telepsych, it's actually indicated as a mode of treatment.